seconds.
Hello, everyone, and welcome to today's press briefing. I'm Donna Bush. I'm so happy you could join us on our various channels, as well as on Radio Cayman. We begin with a prayer from Pastor Gareth Haylock.
Let us pray. Our most loving Heavenly Father, we thank you for another opportunity of being able to call upon you. Lord, you said in your word that you are not weary of our oft coming to you. Lord, we approach you this morning on behalf, or this day on behalf of our government, our entire island. Father, you said in your word that wisdom is justified of our children. And we pray for our government. We pray for those, Lord, that are in authority. We pray that you'll give them wisdom. We know they're precious to open up, but Lord, we pray that you will just help them to lean on you and not to their own understanding. Father, take us over, bless, lead, guide, and direct, and surely we will not forget to thank you, Lord, as we see the threat of the virus spreading in our community. We pray, Lord, that we might take it to heart and it might really be the means of our people being drawn back to you. Righteousness exalteth a nation, and sin is a reproach to any people. Speak to all of our hearts, and we'll give you thanks in Jesus' name. Amen.
And thank you, Pastor Haylock. We now welcome our panelists, His Excellency Governor Martyn Roper, Premier the Honourable Wayne Panton, and Minister for Health, the Honourable Sabrina Turner. With us in studio are the Chief Medical Officer, Dr. John Lee, senior health officials and senior civil servants, the media, and of course our sign language interpreter. We also have some members of the media joining us via Zoom. We first go to Dr. Lee.
Good afternoon. As of 8 a.m. this morning, Thursday, the 14th of October, there have been 896 PCR tests since the last report on Wednesday morning, and of these there are 4 positives in travellers exiting quarantine and 12 positives from the community, which include 4 children. Within those community members, there are some adults which are not connected to the school outbreaks. There have been 109,919 vaccinations in total across the Cayman Islands, and of these there are 55,780 which are first doses, representing 78% of the 71,106 estimated population. 53,365 people have completed the 2-dose course, which represents 75% of the population, and 774 people have had a third or booster dose, which represents approximately 4% of those people over the age of 50. Since the 8th of September, there have been a total of 188 people who have been positive in the community. This is on a background of 25,203 tests, so we can see that 25,000 tests since that time have also been negative. As of yesterday, we had a total of 184 cases that are prevalent in the community, giving us a 0.26% prevalence positive rate. The booster program is from today open to anybody over the age of 60. Please can I remind anybody that feels they need some assistance, a community member who perhaps might be bedbound or who finds it difficult to leave home, to let public health know, because they will be able to come out into the community to provide that booster dose. We have a combination of both the AstraZeneca and the Pfizer vaccines available for use, so please let people know if you have a particular preference to have the AstraZeneca, as we have a smaller number of these doses. You will be aware that the government is planning a rollout of lateral flow tests nationally, and the policy related to this will be advised to the public in due course. It hasn't yet been finalised. I'm also planning now as a little surprise event to give Donna a lateral flow test so that everybody can see on camera how this is done. First of all, do our hands cleansing, please, and then we'll get the test kit out. It is a relatively quick process. I hope you're able to hear me okay. There's a little hole here, which I'm just going to punch out, a pre-formed hole in the card. And there's a tube of liquid here, which I'm going to place into that little hole. I really need 3 hands rather than just the ordinary 2. And Donna, if you take that swab,
Okay.
and then rotate it in one nostril, putting it in 1 inch or 2.5 centimeters, just up there,
Okay.
twirl it around 5 times.
Okay.
And then please do the same in the other time, 5 times, a good generous 5 times, nothing half-hearted. Thank you.
Okay, it's all good.
And then I'm going to give you the tube and ask you to do the next bit.
Okay.
You take the tube and then twirl it around in there for 30 seconds. And we're going to hope that 30 seconds have passed. We haven't timed it exactly. And then as you're taking the swab out, if you squeeze the tube, so you hold back all the liquid, and then I'll put the little lid on there for you to put on the top.
Okay.
And you can put that thing without touching me into there. Dispose of it in the biohazard bag. Put that on. Yep.
Okay.
And then put 4 drops into the S. I'll just show everybody the strip. 4 drops into the S. 1, 2, 3, 4. And then put that into the biohazard bag.
Okay.
And then in 15 minutes, one of the press will time it for us. We'll come and have a look at the result.
Okay, that's it. All right. All right, Dr. Lee, if that's it for you at this point, we're now going to go to His Excellency, or Premier Panton, actually.
Thank you very much, Donna, and thank you, Dr. Lee, for that very able demonstration of the ease of use and convenience of the lateral flow tests that we will be detailing more fully, as Dr. Lee indicated. Let me just say, get back to the right protocol. Good afternoon to everyone. As a part of our commitment of the government to keeping the community fully informed and connected, today's press briefing is designed to share several important updates in relation to the current community transmission and our progress towards getting ready to reopen. Firstly, I'd like to start by thanking the community, thanking the people of this country, the people of the Cayman Islands, our wonderful country, for their continued cooperation as we navigate the uncharted waters of community transmission amongst students, in particular, our unvaccinated population. I know that this represents scary prospects for parents and for the people of the country. It really reflects, sacrifices being made by students, by families, by educators, and by employers as well, because we know the impact that it is having across the board, both on businesses in particular, particularly small businesses. So thank you for your patience and understanding and willingness to continue to work together for the greater good of the country. This experience that we've had over the past weeks has certainly been a very invaluable lesson in terms of our preparedness ahead of a full reopening. The government and everyone involved have learned very valuable lessons. It's provided us with opportunities, not just the government, but the whole country, the whole community, the opportunity to observe, to learn, and to gather evidence around what's working well and what needs adjustment. The fact is, community transmission is now a reality. We feel we are using the right strategy in our approach in respect to this, and I think the facts bear that out. We have been very blessed as a country to not have mass hospitalizations. We do not have a large volume of people being seriously ill, and thanks to God, we haven't had any issues with death or anyone even close to that. And that is certainly the direction that we want to maintain. We have certainly had many examples of some of our regional neighbors who haven't had quite the same experience, and this is one of the things we absolutely want to try to avoid for our country and for our people. Now, as troubling as the school outbreaks appear at first, we have now experienced for ourselves what medical experts around the world have told us, that children do show remarkable resilience. As scary as it is, we have learned firsthand that they do show remarkable resilience to this virus, and it in fact it gives us greater confidence in moving forward and learning to live with COVID-19. And through these lessons, we have learned, as I said, we've adapted. We are amending our reopening plan, and our plan was, and the contemplation around it was specifically along lines which would allow flexibility, allow us to adapt and to be responsive to a variety of circumstances. I do also want to be very clear that the path that we are on, undoubtedly, both in terms of community transmission and specifically in relation to our reopening plan, when we get to the point that we do drop the quarantine, we will have more COVID-19 positive cases. Our priority as a country remains to minimize serious illnesses that require hospitalization, and I think that we are on the right path for that. I want to say as well that undoubtedly it hasn't been as smooth as we would like. I think perhaps we were being a bit naive in assuming that we would not have the lessons and the bumps that we have experienced and that other countries have also experienced as well. So it has not always been as smooth along this path and as pleasant as perhaps we would like. And of course, some of the major pain points for the community have been around the isolation of families, the school closures, the increased quarantine occurrences, and the resulting impact, as I mentioned earlier, on employers, employees, and business owners, all of which we understand and we have great sympathy and respect of. So today we want to be able to deliver important updates and provide information in relation to adjustments that we have made in relation to our reopening plan. While there is certainly no playbook or no definitive playbook for managing COVID-19, we continue to learn from other countries around the region and the world. And yes, our own experts and capable personnel in the public and private sectors. So we, together as a country, together as a government, and the various bodies that are involved, we are writing our own playbook, and these experiences and lessons have formed a very strong part of our strategy and approach as we move ahead. So what are the tangible steps that we have taken? We are going to be reducing isolation periods, and we have announced that already for those who are vaccinated. We want to strengthen humanitarian support, including for those who are quarantined, and to transform the entire quarantine process by introducing the lateral flow tests that you just had an earlier demonstration in respect of. All of these, ladies and gentlemen, are very tangible steps which are designed to allow schools to remain open, to reduce and amend the isolation and quarantine requirements, which will result in improved lives, improved business continuity, and a more functional approach across all of our society. And that is a very desirable objective. And this brings me to two very important announcements. We will be having a pilot for lateral flow tests. We have the arrival of our first orders of lateral flow tests, and we recognize that we will soon have the opportunity to make a very profound impact through the use and application of these tests on the community, especially when the larger orders arrive. While we expect to share the national lateral flow policy in the coming days, we have an opportunity to conduct a pilot with some of the families of our school children who have been very significantly impacted by the isolation and quarantine requirements more recently. So to this end, we are going to have a medical team setting up a small pilot this weekend for families who were isolated as a result of exposure risk at school, but do not have positives in their household. This will be allowed to come. They will be allowed to come into a testing center where lateral flow tests will be conducted. They'll just as we've had the demonstration here today. There will be a demonstration as to how they utilize those. And if they are negative, they'll be free to leave quarantine. They will be given sufficient number of tests to conduct daily lateral flow tests until the end of their intended quarantine period. And they would be required to report those test results to public health. I want to emphasize again that this is a test. It's a pilot, which will allow us to evaluate how the lateral flow tests are being utilized, how they're reported on, and more importantly, it will bring much-needed relief for some of our families of students who have been impacted. I think this is a demonstration of the potential benefits and how this will make a difference. So I want those perhaps that are not participating to feel that feel a sense of hope, feel a sense of optimism that this is going to be this approach is going to be a real significant game changer for how we manage and deal with this going forward, and how we reduce the significant levels of inconvenience to families that we have been experiencing. The second point I want to make is in relation to removal of secure verification. The government has agreed to change the regulations next week so that there will be no requirement to present a securely verified vaccination certificate for Caymanians and returning residents who have been vaccinated overseas with an approved vaccine course. This means that these individuals will be able to return home and will be eligible for the current 7-day quarantine period, which, as at this point, would ordinarily require them to have a securely verified vaccination status, which in general is the QR code. And this change is the first in a series of changes that we will be implementing, and this, we'll have more to say about this in subsequent press briefings, which will likely I'll likely indicate later on will be in the coming days. I also want to note that Parliament recently passed as you know, the Immigration Transition Amendment Act 2021 and the Customs and Border Control Amendment Act 2021. Those two acts come into force as of this afternoon upon publication in the Gazette. A press release will be issued at that point, so this afternoon, which sets out the list of the details around the acts and sets out the list of circumstances under which amendments made to the underlying laws by these amendment acts are applicable to the persons covered under those acts. There are some important steps we must take before we can reopen our borders. We're all familiar with the Jamaican saying, "We must dance a yard before we dance abroad." In this context, it is absolutely essential that we get the management of COVID-19 in the community properly functioning for our own resident population first. And then we can wisely and safely welcome visitors back to our shores and ensure that our systems are tested and fully proven in the event that any of our guests require isolation or quarantine. I'm sure that many of you tuned in today hoping to hear that there would be a specific date in terms of reopening. Let me say I'm pleased to say for those of you who were expecting that we will be holding a press briefing next week to provide the country with specific information around the reopening date. So it won't be today, but we will be giving you that information next week. Just as important as the date is to ensure that the details around the reopening plan are in place. I think it is safe to say that based on all the lessons that we have learned, we have really significantly built the resilience of our reopening plan, and we are very close to finalizing that. The team working on the reopening plans and testing our preparedness have made very, very significant progress. So we are a lot further ahead than we were in recent weeks, and I'm very happy with the state of of progress and the state of preparedness that it truly reflects. The plans are being adapted, again, as I said, to learn from the level of community transmission and spread that we've had, and we will be ensuring that we're capable of further adaptations based on updates on the level of COVID that we have in the community. Our vision as a country and as a government remains, as I've said several times in the past, I said it fairly more recently in Parliament. Our vision remains in getting the country to a point where we can safely reopen and remain open in a responsible way, while limiting the strain on our healthcare system and keeping people alive. I know I've said recently that we want to minimize those people who get seriously ill. We want to minimize or eliminate deaths as far as possible. Perhaps that is something that is too much to hope for. But I really truly feel that as a community, deaths are not a statistic. They are real people. They're wholes in families. And as I said, I want to thank the community for cooperating in the past, and for all the work that has been done, and for the sacrifices that have been effected in order to get us to the point that we are at. It is really truly up to all of us as a country to maintain that level of safety and cooperation and contribution to attaining that level of that goal, that objective. We have to do this by maintaining our COVID-19 safety protocols, getting vaccinated. I was going to say that, right? Following the advice of medical professionals, and yes, keeping ourselves healthy. I continue to encourage you all to remain prepared with your own health and wellness plans and practices. I'm going to say it again, continue to get vaccinated. This is the best, absolutely best tool that we have in our toolkit to maintain wellness and to keep people from getting sick and dying. Get your booster shots. Those of you who qualify, get your booster shots. I know it's being done in stages, and I think right now they're entertaining those who are 70 and older and those who have vulnerabilities, but we will get there. And please go ahead and get your booster shot when it is time. The other thing is we need to stay calm. We are absolutely in this together as a country, and we will absolutely come through this together. I believe, ladies and gentlemen, I believe very strongly in the resilience and the strength of the Caymanian community and the people of this country. Our sacrifices will not have been in vain. Our tireless efforts to comply with guidance, to listen to medical advice, and to trust the scientists and the science and the medical professionals who have dedicated their lives to healing and to advancements in treatments. Those are all things that are very worthwhile us putting our trust in. It is because of our difficult and, yes, uncomfortable experience of once again facing community transmission that we can now see a clear pathway to living safely with this virus. I can assure you, ladies and gentlemen, that better days are absolutely ahead for our beloved Cayman Islands. And I thank you for your attention. And over to you, Your Excellency.
All right, thank you. Thank you very much, Premier. First, let me just say I fully agree with what you've just said, Premier, and really welcome the two important sort of initiatives you've announced today on the securely verified vaccinations change and on the pilot of the lateral flow tests. And as I've said before, reopening is likely to be one of the most, if not the most, difficult decisions of this government. And I know how much effort, how much care, and how much hard work this government is putting in to getting that right. The Premier and his team have been crystal clear with the civil service, what they need to be able to move forward with decisions on a reopening date, which Premier announced will be a press conference next week to give clarity on that, removing quarantine for vaccinated travellers over the next few weeks. And let me just say that the civil service, led by our Deputy Governor, is being put under a lot of pressure by this government to do an awful lot of work connected to this reopening, but they are rising to the challenge, and I see that every day. I also hope we can keep politics out of our COVID response, because it requires all of us to come together as a community and support the decisions that are taken in the interests of all of us. And let me also once again thank Dr. Lee, HSA, everyone at Public Health and Travel Cayman for going over and above in recent weeks to protect us all. And everybody out there in our schools, the parents, everybody who's been going through challenging times connected with the COVID cases, like the Premier, I want to add my appreciation and thanks to all of them. We've been living with COVID in our community for some time now, and I know it has been hugely unsettling for many people, and perhaps many people thought we could permanently avoid having to face the virus. But we know that that is not the case, and now we have it here. But as the Premier said, I do believe that our experience has reinforced what the experts were telling us. Children, when infected, generally do not get seriously ill. And having a highly vaccinated population stops the virus spreading in the way that it otherwise would. And I really hope that as we plan the reopening of our borders, this real-world experience reassures everyone that we can live with the virus. Now, as you have heard today, part of our strategy for living with COVID will involve the regular use of lateral flow tests. And I believe these will be a game changer in our response to this pandemic. My office is supporting Cayman in purchasing hundreds of thousands of these tests from Crown agents in the UK. They're a not-for-profit international development company that works in partnership with governments tackling complex challenges of supply and procurement. They're reliable, they're incredibly competitive, and we can be 100% sure about the quality of their product. Now, the tests will be used in many environments, as the Premier said, such as schools and government buildings, to help quickly detect anyone who is infected. Businesses can also purchase and deploy them as part of their own COVID strategies. A regular testing regime will hopefully mean an end to long periods of quarantine for those who have had contact with infected people. And as I said, I know how difficult that has been for very many people in our community in recent weeks, and the financial costs of that are significant as well. Now, there was some excellent news from a recent study about lateral flow tests. University College London researchers yesterday said that these tests are very good at detecting people most likely to spread COVID-19, and the positive results can be trusted. So people who get a positive lateral flow test result should trust them and stay at home. And this study has shown that lateral flow tests are more than 80% effective at detecting any level of COVID-19 infection, and likely to be more than 90% effective at detecting those who are most infectious when they use this test. And these figures are better than previously thought. I'm pleased to see that HSA has announced the vaccine booster programme and that over 700 people have received theirs. The UK has again provided these vaccines free of charge to Cayman, so please do come forward when your time is called to get the booster. And you know, the booster will be the best way to manage the serious risk posed by the virus. I do think it's also worth noting that while studies show waning immunity from the vaccines, they also show continuing strong protection from serious illness or death. Sadly, that means that anyone unvaccinated runs an even greater risk of getting COVID from someone who is vaccinated. And as we've all said on this panel repeatedly, on any objective analysis of the risks of vaccinations, leaving aside all the misinformation on social media, it comes down heavily in favour of taking the vaccines. We care about everybody on these islands, and that is why all of us on this panel, Dr. Lee, and the overwhelming majority of doctors here and in the UK, believe we should all get it. One word on travel to the UK. At present, you need to take a letter from HSA showing you have been vaccinated to present to UK immigration to avoid isolation in the UK. We hope very soon that the UK authorities will accept the report that you can now print yourself from the HSA patient portal to simplify travel even more. My office is lobbying hard for that at present, and we'll let you know just as soon as we can. To conclude, I believe we are coping well with the recent community transmission. The vaccines are working, and our take-up is one of the best in the world. If we can't open up in the coming weeks, nobody can. Let's move forward confidently with the knowledge we have learnt, important lessons from the recent outbreaks, and we are even better equipped to respond. Thank you.
Good afternoon, and thank you, Donna. There is a number of public health updates that I'd like to share with each and every one of you today, and I will also do my best to clarify and expand on the viewpoint and the role of the Ministry of Health and Wellness and its teams, and in these matters which, you know, are of utmost importance to the nation as a whole. Our primary goal as a government, as we have often said, is to safely reopen our country and remain open while keeping hospitalization and deaths from COVID-19 to an absolute minimum. I can assure you that other countries in their opening, no one guaranteed or no one can say that they haven't lost a loved one. But as your caring administration and your elected government, we are doing everything possible to minimize that. And I wish I could use the word, it will never happen. These days, the level of local transmission, as we've seen, that is already in our community, has caused serious disruptions to everyday life for many adults, children, and a lot of our businesses. Of course, our public health team has been at the front lines battling this and pretty much navigating uncharted territories, coming under great demand and strains pretty much in real time. And in the center of the response in caring for the testing, positive cases, leading into the result of contact tracing, and retesting of all of these persons as they're being identified. Now, public health is also responsible for the case management of all positive persons in isolation and who they are aware of. And in addition, they are testing travelers in quarantines at all stages that poses a threat or could be a positive risk to our society. Now, I think we can all agree that vaccination and contact tracing for this jurisdiction have been an integral part in keeping the COVID-19 virus at bay for as long as we've done. But at the same time, we must understand that it's significant. It is a significant undertaking for a small team, as small as public health is, who are working as quickly with what resources they have as possible in order to meet the demand and address all needs as soon as they become apparent to us. Now, in particular, we're working with colleagues across the government and in the community to ensure that we all provide the necessary care and compassion to all those persons in isolation whose cases require management. We do understand lives are being interrupted by a simple call or aware that there's an outbreak in a class. Your life can change one phone call, and we're letting you know as your public health specialist and as a government, we are here for you. But as we move forward, we're also refining our tracking and reporting process within the public health in order to minimize the impact on families, but also to build a capacity for dealing with larger number and of cases. By doing this, we aim to ensure that our safety that our society can remain as open as possible. But in particular, the goal is that the schools will be able to continue to safely educate our precious gems. They're our children. As we've seen, as demonstrated here, and I know everybody must be saying, what is Donna's result? She's negative. And we've seen the demonstration here with the lateral flows, and we're going to be using these in our schools and our communities. We'll be going a far way in this regard by quickly identifying or being able to identify the positives, and by implementing isolations or quarantine measures as needed. These lateral flow will also allow us to control the spread of the virus, and is vital to learn our way of learning to live with COVID in our community. To do this successfully, we must also adhere, and I am pleading to people to adhere to the COVID-19 safety protocols. Now, this includes, of course, and you're going to hear us, we are a government that we are encouraging and promoting vaccine uptake. And we're encouraging that for persons who are not, but also following the advice of our professionals for the overall safety and healthiness of our community. We are in a good position to do this because of the boosters, as you've heard, and they are now available for persons, and I know the Premier said 70, but they're actually available for persons 60 years and older. And the really, really high-risk categories of persons, and definitely are healthcare workers. For those who are seeking, let's say, vaccine choices, as stated earlier by Dr. Lee, we are continuing in offering the AstraZeneca, and more choices are to come. And for those who are interested in the AstraZeneca vaccine, you should feel free to reach out to the flu hotline. Now, public health and our ministry have worked together to make isolation and quarantining less difficult for families and children, while also maintaining safety standards in curtailing community spread as best as possible. So, as such, and the Premier alluded to earlier, there have been some changes in the isolation and quarantine protocols. As of Tuesday, October the 12th, public health reduced the isolation and quarantine periods in the community and transmission cases of COVID-19 for fully vaccinated individuals. And for those positive cases who find themselves isolating by themselves are to be tested on day 11 of isolation, and will be released only if they get a negative COVID testing. Positive cases with vaccinated household members. If all are vaccinated persons, they will be tested also on day 11, along with the positive case, and they will be released once everyone in the household tests negative for COVID-19. We do understand that persons are getting calls. Let's say there's a household of 4 or 5 persons, and the household will get a call stating 4 are negative, and there may be 1 or 2. That lag time will be possibly because your sample has to be rerun through the machine, and you will be called afterwards. But the takeaway from that statement is that for all of those persons isolating in the house who have gotten a negative response, we're asking you to remain at home until all persons have received their results. Positive cases with unvaccinated household members. Now, if you're unvaccinated, they will be tested on day 15 along with the positive case, and will be released once everyone in the house is tested negative for COVID-19. Now, if a household member is fully vaccinated, example, a parent of a child under vaccination age, this is where there's a little change. The individual can test on day 11 and be released as long as they do not go back into the home until the positive case and other household members have tested negative. Now, we hope that this will ease some difficulties of those parents who needed to go back to work and who have access to sufficient childcare, and that they can continue to isolate separately from the children in the home. Further to the report, to support working parents or even those persons who are self-employed, during the mandatory quarantine, the HSA and Public Health have also coordinated grocery assistance through the flu hotline. I must take this opportunity to apologize due to circumstances and technical difficulties beyond their control that the flu hotline was down earlier on this morning, and that is now being resolved. But for those persons needing grocery assistance, we are asking you to reach out to the flu hotline, and their contact details are 947-3077, and the toll-free number is 1-800-534-8600, or you can email the flu hotline at hsa.ky. That's flu@hsa.ky. Now, families who need this help can reach out, and those requiring grocery assistance will be asked a few questions pretty much to gauge the needs assessment, and then they can request, and it will be passed on to the Red Cross, whose volunteers will be supporting in the deliveries. Hazard Management, Cayman Islands as well, and Foster Supermarket are also a part of this initiative as a part of the grocery assistance program, and standard grocery packs will be delivered. Now, where families need specialty items such as diapers, formula, and adult hygiene products, these will also be added, but only as required. We're asking that if people need proof that they're in quarantine, to share with their employer or to even avoid having their utilities shut off, they can email quarantine@hsa.ky. We will supply them with a letter for this purpose, and alternatively, they can also call the flu hotline to coordinate this as well. For a matter of information, the contact details are 947-3077 or 1-800-534-8600, or you can email them at flu@hsa.ky. Now, there's a launch to expand the public health call center, and being able to keep up with the increased demands on the flu hotline, we are bringing on new team members in public health, including clinical and non-clinical staff. A new phone tree, including scripts with frequently asked questions, will help funnel calls to the appropriate team members. And the aim of this is to provide a faster response time and to improve customer and patient experience, understanding how isolated one can feel when they're actually subjected to quarantine and isolation techniques. Now, as mentioned at the beginning of my remarks, we've learned that there are areas of our public health response that definitely needs more support. In fact, the public health care system is ramping up in several ways to ensure that we know that we'll be ready to meet the challenges that may land on our doorsteps in the coming months. As we have noted, that we've just increased the recruitment of additional staff, and that has been going well, and I am pleased to hear of the new job placements for many, many Caymanians that will help to enhance our COVID response. We also continue to provide additional resources and support to public health and the HSA to ensure with full readiness of the healthcare system in anticipation of any surge in COVID cases in our population. As mentioned a few weeks ago in the press release, we have a total capacity across our healthcare sectors in the Cayman Islands. Our bed capacity is 246. HSA has a capacity of an additional 7 beds with the activation of the respiratory care unit as part of the COVID-19 response plan. Now, the care of severely ill COVID patients requiring ventilator support will be coordinated between the Cayman Islands Hospital and Health City with current combined capacity of 42 ventilators. There are 2 ventilators at Faith Hospital for the care of patients over in our sister islands, Cayman Brac and Little Cayman, and which are used for transport. Any COVID patients requiring ICU treatment will be cared for in Grand Cayman. In terms of health sector workforce, at the end of August, there were approximately 321 actively practicing physicians that are registered with Medical and Dental Council, and a complement of 515 nurses with active Health Practice Council registration. Now, this includes specialty trained nurses as well. The COVID-19 National Task Force, which consists of local public and private clinicians, have been working together to update clinical guidance based on new scientific information about COVID. And I can tell you, each and every one of you, that almost change on a daily basis. We can strategize now, and within 24, 48 hours, there's new cutting edge information. So this is constantly moving. Now, the public and private guidance document will allow recommended clinical treatment and flow of COVID-19 patients. And I am pleased with the work that the team and to commend the collaboration between the public and private sector in the national interest during this critical time, because we can't fight this in silos. We have agreed, and I applaud the governor for actually making at the beginning of his statement that politics has no place in fighting and combating this virus. Thank you. With regards to the treatment of COVID-19, the Health Services Authority now has adequate stock of variety of U.S. FDA-approved medications for the treatment of COVID-19, and additional stock are on order. I would also like to remind everyone who has not yet done so to sign up for the My HSA Patient Portal. Now, this is a platform that hosts your digital vaccination certificate, as well as results of your PCR tests that are administered by the HSA. There are approximately 97% of the QR codes that are now available, which have been a huge undertaking on behalf of the healthcare staff. In addition to in-person sign-up, any HSA registration officer can now sign up online at hsa.ky. Yet, in addition to COVID-19 prevention and the safety practices, we all need to be conscious and look after ourselves and our loved ones. There are so much simple ways of doing this. First, we have been repeating to ensure to everyone who's eligible and their families to get vaccinated. And if you're told to quarantine, I beg you, please be sure to follow these requirements. Please stay in your home or temporary residence, and do not go to work, school, or any public areas. It's not cool after you've been told to isolate to go down the road for a six-pack. You are pretty much exposing everybody who's at that register in preparation for your isolation. Go home, call your friend, call your drinking buddy, and say, please, I'm in isolation, just put it on the front porch and call me when you're outside. Do not go to the nearest service station and buy that six-pack. I have to repeat it. Have food, medication, and other supplies delivered to you, and do not have any visitors at your home or temporary residence. We can all do this together, but simple little steps like that will help us combat and control and manage the spread of COVID-19. Outside of quarantine and in our usual everyday lives, we can also take steps to prevent the spread of the infection. That is frequently hand washing techniques with soap and water, alcohol-based sanitizers, and we know what we have to do. Sneeze in a tissue and toss it in a bin. And of course, we should always take care of our health and overall well-being. It is the only thing we can do to look after ourselves and others. To ease our minds, to be sure to keep in contact with friends and family, even if it is by phone or online. It is also beneficial to carry on your hobbies and interests and keep anxiety and worry at bay. If you should test positive at any point and develop symptoms, seek help by calling the flu hotline. Again, that's 1-800-534-8600 or 947-3077. For emergencies such as difficulty breathing, call 911. These may sound like very simple everyday actions, and they are. But by being mindful of protecting your own health, we can have a sense of calm and control that will help us handle the changes that community spread has brought to our lives. Although these changes are at times unsettling and often life-disrupting, we have seen that we can get through them and emerge on the other side quite safely. Please keep well and be safe. Thank you for your attention.
Thank you very much, Minister Turner. We're going to now go to members of the media, beginning with Wendy from CNS. She joins us via Zoom. Wendy?
Hi, Donna. Thank you. Hello, everybody. Sorry I can't see you, but I'm sure you all look great. The first question I have really is about the rapid tests. Was the problem or the hold-up with the policy? I mean, it seems that is the key to getting this unsustainable situation with quarantine sorted out. So what's the problem? Could you hear me?
Yeah,
Wendy, you're asking me what the problem was in relation to
I'm just
rolling out
wondering,
the lateral flow test?
I expected all the policy stuff today and that you'd be telling us how it was all going to work out and that we'd all be getting them tomorrow.
So we are having a meeting with the program board tomorrow, and at that meeting there will be a thorough outline of all of the processes around the lateral flow test that we will be utilizing. So that meeting will outline all of that, and we will be able to provide further information at the next press briefing, which will outline the complete process around that. I think that will provide the information that people do need. We have been seeking to obtain the lateral flow tests in sufficient quantities to begin this process, but the program board has been working for, I think, probably the past week or week and a half, specifically on developing the right process around this, because there are issues with it. I mean, if we are asking people to test at home, we want to make sure that we can be able to inform them as to how to do the test, but also there are certain other things like ensuring that we don't disincentivize people from properly reporting. We've got to have the data which is passed on to public health. Mm-hmm. So there is a really important work around the process, and I know I have complete confidence that the program board has done a tremendous job in respect to that. When this is all rolled out, we are going to have probably one of the best lateral flow test processes that any country in the world will have had.
Okay, will people be required to pay for them?
I suspect that they will be available to purchase from private suppliers, from pharmacies, but in general, they're going to be. The government will have sufficient supplies to be able to utilize for all the government offices, for all the schools. So that yes, I imagine there will be some that will be purchased by people who just want to test themselves, who do not have any specific reason.
But will they be free for example, a kid tests positive in school?
Yeah.
So
Yes.
all
Yeah.
the
Yes.
parents, so those people will not have to pay for them.
The answer is yes to that.
Okay, cool. So they'll be free there. Also, the pilot at the weekend, those people who test negative, they'll be able to go home and go about the business, and they won't actually be in lockdown quarantine, even though they'll be counting the days, kind of thing, with the tests. Will government be prioritizing those families that are particularly vulnerable in terms of the fact that the breadwinner might be self-employed, or where we've had cases of people that have already been locked down for 2 weeks, and then their kid tests positive on day 15, so they have to lock down for another 10 days. Are you prioritizing the pilot, or is it just going to be random selection?
I think perhaps Dr. Lee is probably the best person to outline how the pilot will be conducted. So if you give him an opportunity to come to the mic.
Okay, great. Thank you.
Good afternoon, Wendy. The plan
Thanks,
is
Dr.
that,
Lee.
as Premier announced just now, that we will be looking at all of the schools that have been put into lockdown for households that do not have a positive amongst them.
Oh, okay. Right. But just to be clear, the people that will there be any other, like I say, the people that are self-employed and that have had the most difficulties with these lockdowns, if they're negative, would they be prioritized or not?
We're hoping that everybody will be part of the plan if they do not have a positive household amongst them.
Oh, so it's all of them?
Yes.
It's not just I got the
schools.
impression it was just a small selection.
No. So everyone. And then if everything goes to plan, and I'm sure there'll be a lot of learning amongst that pilot, but I mean, the learning I suspect will come quite quickly, then we plan to roll that out to the people who, the other case, the scenario that you gave, where somebody may have found themselves in an extended period of lockdown because somebody's been positive at the end of an isolation period. We'll be looking to do that as soon as we can early next week.
Also, what kind of consideration is going to be given to families whereby there are cases of children being positive, or where somebody's already had the virus and they may, a child in particular, so they have the antibodies, but somebody else in the family has to lock down. Is there going to be any way of countering the fact that, oh, actually the kid's not vaccinated, but they've had it already, so they have the antibodies? So is that going to be given? Is there any way of making that label be the same as being vaccinated, if you get what I'm saying?
It's not the same as being vaccinated. We're not planning to do that. The strength of the vaccination is several-fold stronger than being unvaccinated. That is not currently our intention. Vaccination is by far the best way of giving yourself protection against future COVID, and that's been shown quite widely. But
I didn't mean it as a replacement, but just for children, because they can't be.
But clearly, in a particular case, we're getting into quite a lot of detail here now, that public health would always look at the case and make a determination. So clearly, if there was somebody that had already been infected, then that would be taken into account in examining any particular household.
Okay, great. My next question is really about the management of those that are in quarantine. Whilst I appreciate, I think this might be a question for the Minister actually, whilst I appreciate that we're now looking at recruiting more staff, can we get some sort of numbers on that? Because we're hearing an awful lot about people stranded and stuck, not getting groceries, not getting support, especially people who are in low-paid jobs or who are self-employed and can't go to work, and so they're absolutely strapped. And some of them have been in quarantine for a long time, and this is kind of quite common. So I just want to make sure that we are doing something to make sure that that's not happening.
I think she's asking.
And if we can get some numbers on the amount of staff that have been added to the teams. Hello?
We're just trying to sort out who's the most appropriate to answer your question,
Okay,
Wendy.
thanks.
Yeah, they're being hired.
I'm sorry, Wendy, I don't have those numbers to hand.
Okay.
I'm not
I just wonder whether the minute.
I'm afraid I don't have that to hand.
Okay, so we don't know how big the team's been grown, but is it? Are we sure that everybody who's in need is being fed? We just had a lot of calls, that's all, and a lot of emails about that.
Again, Wendy, I'm sorry, I'm not the best person to answer that.
What we can do, Wendy, is provide you with specific numbers of the amount of household and individuals per household that are actually in isolation. And we do know, which is why we were ramping up the response team and creating that call center. And I know the Premier and myself and other colleagues have been responding to a number of our constituents in doing our part as elected officials. But there is a vetting process, and out of abundance of caution and safety to not only ourselves, but to avoid catching anything, is why we felt it was important to have a robust process for public health in order to meet the needs of those persons who find themselves in this situation, needing food or sanitary supplies. But that's why the flu hotline has been activated and the various email. But Dr. Williams-Rodriguez is here to expand a little bit more on that.
Oh, okay, great, thank you.
Hi, good afternoon, Wendy, and thanks. We do have some number. We have added additional personnel. And I can just tell you now that over 30 persons have been added to public health to help in different aspects. Part of them are to do these welfare calls to individuals in quarantine, and also with assistance of Red Cross, we have continued to deliver food for these individuals in quarantine. Also, we have administrative assistance at the public health office and also on the different testing sites, and also for vaccination. And we have employed 5 new swabbers to help with swabbing individuals on the different sites. We get assistance also to contact those persons who are positive, and also for contact tracing. So we are working with different government agencies, with Travel Cayman and others, and some staff have been seconded from different government agencies to public health to assist with our response.
Okay, great. Thank you. Appreciate that, Dr. Williams. Can I just check? I think, is April able to ask her questions now?
Yeah, she is,
okay.
Wendy. Thank you.
Yeah, she's putting up a thumbs up. Okay, so I'll cede the floor. Thank you very much, everybody.
Okay, thanks, Wendy. April?
Thank you very much. Can you guys hear me okay?
We can.
Okay. So a couple different questions. I think the first goes back to something I asked a couple of weeks ago. I believe really this is for the Premier, but it could be Dr. Lee. And I'm just kind of following up on whether we have any plans to sort of step up our data collection and data processing game when it comes to statistics and information. It's so important in this pandemic, but also other health issues as well. Has there been any progress, or are we going to be doing anything more? And also, it occurred to us that maybe having an epidemiologist or specialist of some type would be useful for us in matters like this. So I just wondered, where are we on any of that? Is that stuff that we're looking at?
Well, let me just say initially, in general, yes, we are looking at gathering more and more data. Obviously, this is an important part of our management strategy, and because we've had this community outbreak as well, it has provided us with additional data, additional information from which both locally and through agencies like the UK HSA, which was the original Public Health England, they're able to assist us with doing some modeling, for example, to tell us what to expect and how to manage things better going forward. But yeah, it's the gathering of information and data is absolutely going to be very, very important to us in managing COVID going forward. I don't know if the Minister has anything to update, but we're certainly looking at recruiting an epidemiologist to get them on board. I believe some candidates have already been sort of identified as potentials. I'm not sure where we are, perhaps.
Yes.
If someone else has information in the audience, they could possibly indicate any other timelines on that, but I believe that process is underway because we recognize the significance and importance of having someone with those capabilities on board.
Yes, I can confirm that we are well on our way of confirming a full-time epidemiologist under the Ministry of Health and Wellness, and the necessary paperwork to support that request is well on its way, and we should be hearing in very short order of that result. Including that, we've also seen we're going to be data-driven. Just medical on a whole is going to be data-driven, and that's why right now a lot of the modeling that the Premier alluded to is data-driven, and we feel that it's very important to have somebody from statistics, ESO, join public health so that we can get this information, break it down in different areas so that we can make more informed decision at cabinet in order to move ourselves forward. So we're realizing those gaps, we're putting the skill sets in, and we're definitely, where possible, trying to get these skill sets on island if we can't capture them already here as quickly as we can.
So I just want to make sure that I'm being clear. I do appreciate that we do collect quite a bit of data, but sometimes that even makes the problem more challenging because you have to process the data, you have to have the right tools in place and the expertise in order to give you the information that you all need. So I just want to be clear. I'm not saying we don't collect data. I'm thinking really about how you process that information and whether we really have the type of infrastructure in place in this area in order to help guide you as you make your choices.
That's what we're working on, and we're throwing a lot of resources in order to bring that up. I can assure you the Cayman Islands will be very proud of public health. Thanks and no thanks almost in the same breath of COVID-19. It has allowed us to see your shortcomings and work quite quickly, and many a times we've had to take resources from other government agencies in order to make that happen. But I can assure the people of this country that you will be very proud of our public health at the end of all of this safely.
Do we have any idea with Dr. Lee's departure who will be the next CMO? Where are we in that? It could have been announced and I could have missed it, so I apologize.
No announcement has been made. I don't even think Dr. Lee has officially said his adieu. But we know, small island, but we're doing everything in the right processes in order to have that position filled in very short order. And at the appropriate time, we will be making that announcement.
So this question, thank you very much, Minister. This question, I think, is likely directed at the Premier. So I've been hearing a lot of anecdotal things about Caymanian employees from a number of different industries, whether it's law firms or banks or others, that they were given a deadline based around the phased reopening plan, around the 14th or 15th of October, which is now, to either get vaccinated or agree to regular PCR testing or lose their jobs. And in some cases, we're hearing that some people actually left their jobs. Yes, you can't control what happens in the private sector, but do you have any concerns about this type of thing occurring, the potential impact on Caymanian employment? What are your thoughts about this as a potential concern?
Well, I think any circumstances in which a Caymanian loses a job is very, those circumstances are very unfortunate. And yes, if there are circumstances surrounding that where there has been unfairness, there has been unreasonableness, there has been an overly aggressive approach, then we're obviously going to be concerned about that. I am not aware of any Caymanians having been fired. I have heard of Caymanians that you mentioned who have opted not to take the test because they do not wish to get vaccinated and they do not wish to take the test. They do not wish to participate in some of the public health protocols around masking and that sort of thing. That's the only situation that I'm personally aware of. And I do think the whole thing is very unfortunate. I think, we are all in this together, and we all have our own personal and individual rights. But I also think that, people need to be reasonable and rational about how those rights are exercised, and where it involves particularly public health and the potential impact on somebody else who is your colleague, your co-worker, and concerns that they may have about their own safety. I do think that people have to be a bit more rational and reasonable about their approach on these issues. I think if you simply say I'm not interested in getting tested and I'm not going to otherwise comply with the protocols, I don't think that's necessarily the most reasonable approach in these circumstances.
Thank you, sir. And are there any concerns? We're starting to hear more about some of the issues around the economy as we loosen up, not just us, but globally. There have been problems with supply chains and worker shortages and these sorts of things, and consumer prices seem to be going up quite a bit in some areas. Are you concerned about this as a government for the Cayman Islands, considering our dependence on imports and the fact that it already is quite expensive to live here?
Yes, absolutely. We are part of a global economy, and we rely very significantly on imports for our everyday consumption, our everyday lives. So to the extent that we have seen issues around supply chain problems, to the extent that we have seen issues around cost increases, particularly things, even when the product itself hasn't increased in price directly, what has happened also is there's been a very significant shift and increase in the cost of shipping worldwide. So that has a direct impact on our overall costs for that the average retailer has to price their products at. And yes, it is a concern. I mean, we would prefer not to have a situation where we have significant inflationary impacts on the country. But it is something that is difficult for us to control, given our reliance on imports, and given the fact that this is occurring across the world. It's not that it's in any particular region or area, and it's hard for suppliers to find alternate sources at lower cost centers. So I think those are significant issues that we need to keep an eye on. And to the extent that government has policy levers that it can utilize in order to try to minimize the impact, and we will be looking at those very carefully.
Thank you very much.
Okay, April, thank you very much for those questions. We now call on Ralph from the Cayman Times for his questions.
Thank you, Donna. Good afternoon to the panel. It's good to be back in studio. We have a few questions. I'd like Dr. Lee. The first two. Dr. Lee, we have seen an increase in the number of symptomatic cases recently. And this is an indication that more people are getting sick. Can you say the reason for that? Why that is so?
I think it's just the sheer numbers, really, Ralph. As we get more people being affected, then we're going to get more people being symptomatic. The virus will naturally also have a predilection for those who are unvaccinated. So that's a cause for concern.
It's good to hear that the kids are handling the virus well, but if we're getting more people symptomatic, with averages, do you think we'll have more demand for hospital beds?
There will. The reason that we've given the breakdown by age is because we know that the biggest impact in this disease is of those who are older, in particular those who are 40 and even more so 50 and above. And in those age groups, our vaccination rates are exceedingly high. They're all over 90% in that group. So that is our protection in that group. A lot of the people who are sick are not necessarily in that age group where the vaccination rates are somewhat lower. I think that's part of the reason why Minister gave the breakdown of our bed capacity. If you look at our bed capacity compared to other first world nations, you'll find that not only does our basic bed capacity exceed them, but also our intensive care and our ventilated bed capacity is several times, not just 50%, but several times that of many countries like Australia or New Zealand or the United Kingdom. So we are well provided for in terms of hospital level cover, but it doesn't change the fact that we're an island nation, and for that reason we want to slow down spread as much as we can in order that COVID disease can be treated alongside all of the other demands on healthcare, and that it doesn't begin to dominate our hospital systems, if you see what I mean.
Okay, thank you very much, Dr. Lee. And now go to the Minister. And that was my concern today, the hospital beds and the capacity. If we do see an increase in hospitalizations of our people, would that be a reason for delaying the reopening at some point, if it gets to that level where we see that we don't have enough hospital beds?
Well, that was the whole idea from the government's perspective in our cautious approach, and definitely they improves the importance of data and modeling. Because one thing we don't want to be faced with is like other countries where they can go from one state to the next. Where do we as Cayman have to go? Which is why we've taken this cautious approach and making sure that our vaccination uptake has been at least 80%. We would love to sit here and say our vaccination uptake is 90, if not 100. As we ease the openings of our borders, we have to be prepared for the reality. But we are a responsible and caring government being guided by public health and professionals to know when enough is enough. And we will make that decision at that time. Once we know that our resources where medical, being able to handle medical is concerned, is stretched. We will not be at a point where we see that going there and not make a decision at that time.
Yes. Regarding vaccinations, Minister, we've seen aggressive measures and encouragement to get more people vaccinated. Are you seeing an increase in improvement in that area? There are some people who will never take the vaccination, we know that. But over the time, have you seen an increase where more people are taking the vaccine because of the efforts?
Based on the stats that I've been reliably informed we've made publicly daily, we have seen an increase. We have persons right now that have been vaccinated at the beginning of the year who are waiting for their booster shots. So that too, and our public health doctors and professionals have told us now that even in England, for those kids who are, I think, 12 to 15 who've gotten one dose, that they will be considered fully vaccinated. Once we get those proven, if that's something that we're going to adapt here, that too will help push up our numbers. So we have seen steadily an increase in our uptake, and we applaud our community for stepping up to the plate and doing that.
Thank you. Before I go to the Premier, I just want to say thank you for advising of my age group that I can now go and get my booster.
Before you ask me, let me just add to that, Ralph. I want to recognize something which is that we are on the edge. We are on the cusp of attaining 80% vaccination rate of the 71,106 population number. That is a very, very significant achievement. There are many who said, months ago that we wouldn't be able to achieve that. And I'm very proud of the efforts that we've put in. And yes, we've taken some flack, and we've aggravated some people, and we've had some vitriol directed at us, particularly by those who don't believe in vaccination and don't want to take it. But this is a very significant thing for us, and it is, we are hoping to continue this track. As Minister has indicated, there is evidence. We have seen increasing numbers. I'm hoping by sometime next week we'll be at 79%, and we're so close. And I think we'll exceed that. But I think it has shown its value to us. I mean, we do have, a lot of people in the community have said to me, why is it that we're having all these children positives? Well, it's because the children are not vaccinated. So it's nothing unexpected. It is scary for us as parents, as people who care about, as far as I'm concerned, other people's children are my children too, and I feel very responsible. You hear the Minister for Education; she very frequently refers to my children instead of saying my students.
Yes.
That's the level of care that we bring to these jobs, and I think what we have experienced so far does underline and emphasize the fact that the vaccines do work. They are working, and it's not going to eliminate the likelihood that as we move along, we are going to have more numbers of positives, more people infected. But I think it can give us confidence that even if there are significant numbers of infections, we are not going to have and I'm crossing my fingers a bit, but obviously I think the evidence bears it out, that we're less likely to have significant numbers of people being sick or worse. So I think that is something that the country can take a lot of confidence from. And we in government, we take a lot of confidence from that, and that is why we have always brought so much emphasis on trying to get vaccinations into people and get the vaccination rate up. I don't think, as I said, that we should just look at the numbers of infections. We need to look at those people that are hospitalized. And our record so far has been really good, and I hope and pray that continues.
I do that. Okay, so now to your question.
Yes, sir.
November 22nd, the business sector has been promoting that date as when we are ready to reopen. Is your date that you'll be announcing next week, hopefully, before that date, around that date,
You want me to spoil it?
I promise to get your crystal ball, remember?
Realistically, I've promised the country that we will provide at least a month's notice.
Yes.
And I think it's, given everything that we have experienced, given where we have gotten to in terms of our levels of building resiliency and preparedness, I think we can, with some degree of confidence, say it will be sometime in November. But I'm not going to sit here and tell you the exact date. We have some more work to do over the coming few days. As I said earlier, we have a presentation from the program board tomorrow morning, and we'll be going through that and engaging with them and listening to that. All of those things are going to factor into our discussions and decision ultimately on when we decide to give a specific time frame that or date that we're going to reopen.
Okay. And the next press briefing will be next Wednesday or Thursday?
It could be. Let's say it'll be next week for sure. I don't want to commit to a specific day, but I think it's reasonable to expect Wednesday or Thursday.
Okay, thank you. And final questions for the governor. Haven't asked you one in quite some time. We've seen some reduction in the numbers of positive cases of travelers, and probably from the UK. In light of the reduction that we're seeing around the world, do you believe that is going to be a trend that will happen in the future, that we'll see travelers with reduced positive COVID testings?
Well, I think that's probably more a question for Dr. Lee rather than me. I think we are going to see people coming in and having COVID, but certainly the UK is still seeing quite a lot of cases. But what's really encouraging about the UK is that they're not seeing that translate into deaths and people being seriously in hospital. So the vaccines are really doing their job in the UK, and the UK health system is coping with a large number of cases because it's not feeding into a lot of people having to go into hospital. So there's a real world example there of what vaccines do, and we have higher rates of vaccine take-up than the UK. So as the Premier said, that should give us real confidence that we can deal with this.
And the final question, so what's your comfort level that the Cayman Islands is ready to deal with COVID?
My comfort level, you'll have to define what you mean by my comfort level.
If we were to open the borders tomorrow and we have to live with COVID, and what's the comfort level of being prepared to live with COVID?
Well, I think the whole world has to live with COVID. It will become like flu, which people get, and very sadly some people do get seriously ill with flu and some people do die. Eventually that is where most experts say this will go. We're not quite at that point yet, and we're doing everything possible to deal with it. But the whole world will have to live with COVID. But the key really is the vaccines.
Thank you very much for your answers. Thank you very much, Donna.
Okay, thank you very much, Ralph. We now go to Andrell Harris from the Compass.
Thank you, Donna. I'm glad that you're negative for COVID as well.
So are we.
No more than her.
Yeah. Just for a bit of clarity, now I know that the minister had previously or earlier in the program said that there was for persons who are isolated, who are in need of assistance, they should be calling the flu hotline. Now, earlier in the month, while during the debates, yourself and Deputy Governor Manderson spoke about a wellness team and a wellness manager who would be tasked with taking care of these household calls and seeing to it that the hundreds of people who are stranded in isolation were adequately taken care of. Is this wellness team a part of the public health team that is manning the flu lines, or did the government scrap the idea about the wellness team?
It's all part and parcel.
All part and parcel. And in that note, there are still hundreds of people, much like what Ms. Ledger said earlier today, that are calling us on a daily. Are you beefing up the team? We know that you said you've already increased the staff, but based on the volume of the calls we're receiving, it doesn't appear to be adequate. Will the government be increasing public health members specifically to deal with people stuck in quarantine?
Yes, but you must understand that you can't just pluck people to put them on the other end of a phone and answer calls just by putting people there. Out of due respect for confidentiality and working within public health, you have to make sure that you align the people, that they have a controlled tone, and that they can handle the information. You have somebody locked down for 7 days, 14 days, and they just got a negative or a positive, and they're subjected to another 14 days. You have to make sure that the person on the other end of that line is nurturing and understanding of what they're going through. So there's one thing of giving them the sufficient resources, but it's also key to align the necessary skill set in order to make that quality experience a reality. So that is what has taken just a little bit time to get that active.
With all due respect, Minister, I think people want to know about the amount of people who will be making these door-to-door calls. I hazard a guess to say that people are more concerned with who's going to drop off the goods to them, what's the logistics behind this, how soon will we have people rolling out, going door-to-doors, answering people's needs?
Well, due respect to you, sir, I alluded to that hazard management and Red Cross are actually helping public health. With the introduction of lateral flow and the pilot that we're about to unleash, the hundreds that you're talking about, which we have to confirm those numbers, will seriously diminish in the next couple of days. My humble apologies on behalf of this nation for not getting it right. But that's why we're working with it and putting and directing the resources as best as we can with something that's happening in real time. We are making it happen. And as I stated before, this nation will be happy and proud of the public health that we will end up with coming out on the other end of this.
Thank you.
Andrea, let me just add to that. We do recognize that over time there have been difficulties. And we get the calls as well. All of us do as representatives. And one of the things I do every day is I try to call at least 2 families every day just to check in with them to see how they're doing. And I have lots of people who send me contact details for new families. And when I get those, I check in with them as well. I haven't lately had any representations that people haven't been able to get food or anything. What I have typically found more recently, like over the past weekend, has been situations where, because of the growing numbers, people have not had the types of contact, the type of telephone response that was promised. And with all apologies to our colleagues on the civil service side and in public health, we do pass those on. And Deputy Governor can tell you that I call him all hours of the night and say, we've got to manage this situation. Because not just because it impacts us as politicians, but because fundamentally people, if you promise somebody you're going to call them and check on them every day, then call them and check on them every day. And if you can't do it, find a way to fix that problem. And those are the kinds of conversations we have, because we are very concerned about making sure that when people are going through difficult circumstances, when they're going through all these uncertainties, that they have someone who is going to be that lifeline for them, who's going to be able to respond to them and check in with them. And that's one of the reasons I take it on myself to do it. I mean, this morning I was on the phone with a family who were initially in isolation because one child was at a prospect school. The rest of the family members are all vaccinated. And when they got the test on day 15, the child had turned up positive. So they've got to restart that process again. Now, I'm very, very sympathetic to those kinds of circumstances, and it takes all of us. If it takes me to call, I'll do it. I want to make sure that the people who need help, who need guidance, who need assistance, who just need a sympathetic ear on the other end of the phone, get that. And that's why we've been pushing to get public health resilience built up and to get the numbers of people necessary. And I am telling you, the staff have been doing a great job. Yes, there are problems. They have been overwhelmed at times, but I'm really, really proud of them. I mean, these are people who have been working their fingers to the bone. It's not because they don't want to; it's because they have so much other things to do. Why there may have been situations where the ball was dropped. So, on behalf of the government and to those people, I apologize for those situations. But we are working every day, and as I'm sure our colleagues on the civil service side are working every day to try to address this problem, because none of us want this. We all understand what it's like for people to be in these types of situations, and we want it addressed, and we don't want to leave them in that situation.
Duly noted. Premier Panton, you stated that as a part of the tangible solutions that you're providing and as a part of the tangible plans for the reopening, you'd be strengthening humanitarian support. How much money has your government earmarked for the humanitarian support? How will people be able to access this money? And for businesses specifically, how much money and support have you put aside for businesses, and how do they also go about accessing this money?
I will have to get back to you with the specific amounts. We have recently taken a paper through which deals with potential stipends for people who are in circumstances where they are in isolation or quarantine, and they have a situation where their employer says, "I'm not going to help you, and you're on your own." We feel it's our obligation to help out. So we are going to move that forward. But we're also hoping that with the rollout of the lateral flow tests and this new process, we will start to minimize those impacts, particularly in relation to people who are in isolation. Obviously, quarantine situations where you have people who are positives in the home, that's a different, potentially a different scenario. But that may also be mitigated in terms of impact through the use of lateral flow tests as we move on down the road. The pilot project that we were talking about on Saturday, we're excluding those that have positives in the home. But down the road, when we have had the full presentation, we have had the clarity that we need in terms of the process and the utilization of lateral flow tests, we may have an impact on even those people who, those family members who are impacted by quarantine situations. So while we are preparing to support the people who need help in those circumstances, we're also putting in place methodologies such as the lateral flow test to help to minimize those who are impacted.
Just so that I'll be able to hold you to your word, will we be provided with those numbers at the next meeting?
I will get the numbers for you.
Thank you.
Yes.
Can you say, this perhaps is a question for another member of the civil service here, how many persons, or what is the number for the amount of people who are on work permits who have not yet been vaccinated? Do we know those numbers?
I don't think know those numbers yet. That information, I think, is going to be provided. We've had a recent discussion about it, and it will require the HSA data to be cross-referenced versus against the immigration or CBC data. So that number or that information we expect to have in the coming days, but I don't have it right now, unfortunately.
And for the matter where the QR code is no longer required for Caymanians and returning residents, is this strictly for Caymanian and non-return and residents, or will this apply to tourists as well?
For the moment, it will be in respect of Caymanians and permanent residents.
All right, just a couple.
So we intend to put that into effect early next week.
All right.
Just to add, I think one of the things for that is we've, as I said before, we've had a lot of representations from families, from mothers who are, very, very protective of their children and wanting to have their children home with their families over the Christmas holidays, for example, in some cases the Thanksgiving holidays. So this, by doing this, it enables them to plan, enables them to be able to take advantage of the period of holiday and break they get from school terms, so that they can come in and if the quarantine is in place, they can do a bit of the quarantine, a reduced amount of quarantine, and still have time with their families. Otherwise, if the quarantine is not in place, then they've got the full time available to them, and we don't have these issues about verifying electronically.
All right. Now I know my time is swiftly going. It would be remiss of me not to state the obvious, that today is the 14th of October, and this would have been the grand reopening day. And along that line, we had promised that we would have had the big draw on right around this time for all the persons who took the jab. Can we get an update on the vaccination prize? When will we have the big, or when will the winner be revealed?
Unless anybody else knows, I don't know.
Yeah, it has nothing to do with government.
Offhand, that is being operated, as you know, as a private sector initiative. We have collaborated, but I don't have the information to hand. We can certainly try to get that to you as quickly as possible.
Okay. I do have a slew of other questions, but I suppose I'll have to wait until the next time.
All right, Andrew.
Thank you.
Thank you very, very much there. Any final words from members of the panel?
I just want to say thank you to all who have participated, to those who have tuned in, who have been listening and watching, and I want to say thank you to His Excellency and my colleague Minister Turner for the contributions today, and certainly I also want to thank the members of the media who have asked some very good questions, and this is the way democracy works. It helps to keep us accountable, and it helps to provide information to the people of the country. So thank you all very much, and thank you, Donna, for doing an awesome job as usual.
Thank you very much. Well,
and for being negative on your test.
Thank you very much. And of course, thank you to the public, and of course the media for being here with us today. Of course, thanks to the panelists for sharing this most all these important bits of information with us. Of course, you can watch the press briefing on demand at the Cayman Islands government's YouTube channel as well. We encourage you to go online to gov.ky and hsa.ky for the very latest on COVID-19 results, as well as vaccination clinics and any other relevant information as it relates to COVID. Until next time, everyone, have a great and, of course, a safe evening.